Hi, I'm Justin Riley. Today on Wisconsin Doctors, we'll learn about the skilled nursing and rehabilitation services that are offered at both Crestview and Fairview through Bluff Medical Center. We'll be on location at Bluff Medical Center to find out some more information, and my guests will include Heather Frank, Director of Nursing at the Crestview location, Gina Locke, Social Worker, Lorraine Anderson, Recreation Services Director, and Mary Brown, the Rehab Coordinator and Physical Therapist Assistant for both Crestview and Fairview. That's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. We are here on location at Bluff Medical Center here in Mauston, and we are learning today a little bit about some of the nursing and rehabilitation services that are offered here through Bluff Medical Center. And I'm joined now by Heather Frank, registered nurse and Director of Nursing at Crestview. How are you, Heather?
I'm great. How are you?
Excellent, excellent. So, Heather, I was going to start off by asking you what types of care and services are offered, nursing care services are offered at both of these facilities?
Well, we offer both short-term and long-term skilled nursing care by licensed nurses and certified nursing assistants 24 hours a day. Some of the things that we provide is helping the resident get in and out of bed, bathing, dressing, getting them up to help walk. We provide wound care, IV therapy. We help with acute medical conditions such as an infection or an illness, or if they sustain an injury. We also do provide terminal illness care. At Crestview, we actually have a Alzheimer's and dementia unit, which is in the same building but in a different area, that we really focus on their needs. We do have some CNAs that have specialized training and rehabilitation, so if the therapists are done with their treatment plan, they can help still provide strengthening or at least maintaining where they're at. And a lot of times we're able to improve their overall health and get them to discharge home. So
that's good, and that's the goal, I think, for a lot of folks, is to go home.
Absolutely.
Yeah, absolutely.
Heather, can you tell me a little bit more about the skilled nursing facility versus the difference between a nursing home?
Absolutely. So a lot of times the skilled nursing facility and the nursing home is kind of used interchangeably, but there actually are a few differences what make us a skilled nursing facility. We are regulated by the Department of Health, and we must meet strict criteria in order to be Medicare and Medicaid certified. Some of the things that we need to have in place is a transfer agreement with the hospital. We have to have skilled nursing staff and rehabilitation staff to manage, observe, and evaluate their care. Some of our skilled nursing staff and rehabilitation staff that I'm talking about is registered nurses, licensed practical nurses. We need to have a medical director that oversees our quality and our policies and procedures, physical therapists, occupational therapists, speech therapists, and so on. So
it sounds to me like skilled nursing has maybe stricter standards that they need to meet. Yes, very strict. Yeah,
yep.
Absolutely.
Yep.
So, Heather, there are so many different settings that healthcare workers can be in. Why did you choose long-term care over other nursing options, and what is it that you find so rewarding about that as a career?
Well, I think it's the wide variety of residents that we serve. We really have to have, licensed nurses really have to have the ability to assess all kinds of different diagnosis. So somebody might be coming in with a hip replacement aftercare, or might have a heart condition, or treating a diabetic wound ulcer or an infection. So it's a really wide variety. And same with the CNAs, certified nursing assistants. They have to really adapt to any type of situation. We really are team focused and resident focused, and we really try to go off of their preferences when they come in and make it a home-like environment. And one thing that really stands out to me is, we have residents that have actually came into the facility that require a mechanical lift and 2 assist, and watching them progress and seeing the improvement to actually walking out the day of discharge, it is an unbelievable feeling.
Yeah, I can imagine. That's great.
Sometimes people are able to rehab to the point where they no longer need skilled nursing care but aren't quite ready to go home yet. Can you talk about if there's different options available for them?
Absolutely. So if somebody transitions from the hospital setting into our skilled nursing facility and we're able to make that improvement, but maybe they're just not quite ready, we do have an assisted living, Great Lakes CBRF, which means community-based residential facility, that can help them in their care further, but maybe not at that skilled need. Or if they're able to go home, sometimes we have able to get fantastic home health services in the home to help them.
Excellent, excellent. Heather Frank, thank you so much for joining us today. Thank you for the information. We got to take a short break. We come back, we're going to continue talking about some of the nursing and rehabilitation services offered at Mile Bluff Medical Center. Don't go away, it's Wisconsin Doctors. Hey folks, welcome back to Wisconsin Doctors. We are here on location at the Mile Bluff Medical Center in Mauston, and today we're learning about some of the skilled nursing and rehabilitation services that are offered here. And next we'll be talking with Gina Locke, who is a social worker. Gina, how are you?
Good, thank you.
Gina, can you tell us a little bit about what role social workers play in the skilled nursing and rehabilitation services?
Sure. First and foremost, the primary role of the social worker in a skilled nursing facility setting is to act as a patient advocate, resident advocate for both the resident and the families. We assist in providing for the psychological and social needs of each resident, and then also assist with coordinating admissions of people coming to the nursing home, and then assist with the entire transition process, and then also with the discharge process and getting them home or to wherever they may be going.
Yeah, kind of meeting those psychological needs I think are very important.
Yes, definitely.
Gina, if a person is planning on needing short-term rehabilitation after an upcoming surgery, how would you go about arranging that?
Yeah, you know, we encourage people, if they are aware of any type of upcoming surgery that they might be having, like a knee or hip replacement or whatnot, and if they are aware that they will be needing short-term rehab after that, we encourage them to call and get their name placed on a waiting list. You know, it definitely helps us knowing ahead of time, so we can try to make sure that we have available bed for them. You know, and then when the referral comes through, we can definitely look into getting them rehab placement.
Absolutely.
So what are some of the most common concerns that family members have when a loved one's admitted to long-term care, and how do you go about addressing those concerns?
I think the most common concern that social workers get, and probably just in general that people have going into the skilled nursing facility setting, is how is this going to be paid for? So it definitely depends on each particular different situation, whether it's a person coming in for rehab or a person coming in for long-term placement. And the social worker's job is to assist the patient and the families in trying to navigate through the proper channels, and if they are in need of funding, and assist with applying for state funding or whatnot, and so forth.
So there's more to it than just the psychological aspect. There's also the the financial aspect. You know,
Yeah,
people have the
definitely.
questions of how am I going to pay for this, and then you
Definitely.
guys help them through that.
Yes.
That's great.
What kind of approach do you guys use in coordinating the residents' care?
It's an interdisciplinary approach, so it's a group team effort. Certainly the resident and the families are first and foremost in that, but then we also include therapy and nursing and rehab activities, dietary, and it's tailored to each person's specific needs. So it's called a person-centered care plan that we focus on.
And there's, I'm guessing that there's probably a number of viewers out there, Gina, who have family members who they are thinking probably will need some skilled nursing at some point in the future. What do you tell viewers about how do they get that started, that process started? How do they talk to their family members about this kind of elephant in the room, so to speak?
Right. And you know, the thing I always tell people is you need to start the conversation early. You need to have it at home. If you are starting to see that your loved one is starting to have increased difficulties and are concerned that they may need nursing home placement in the future, start having the conversation. It's a difficult one to have, but you know, talk with them, talk with a doctor, tour different places. They may not always need the skilled nursing facility setting. They could go to like a place like Great Lakes CBRF, you know, and then it's a lot easier for people to transition into nursing home that have already had that conversation with their loved ones than it is for people coming in that haven't.
Absolutely. And you know, it's a difficult or a difficult conversation for both people, I think, because the folks who know that their, you know, aging mother or father or grandmother or grandfather are going to need that eventually don't really want to have that conversation because there's probably a little bit of guilt there for them, thinking, you know, I wish I could take care of myself, but you know, I'm still working.
Right.
So yeah,
Right.
lots of great things to think about. Gina, thank you so much for the advice today, and don't go away. When we come back here to Mile Bluff Medical Center on Wisconsin Doctors, we'll continue talking about the nursing and rehabilitation services offered here. Stick around. Hey folks, welcome back to Wisconsin Doctors. We are on location at Mile Bluff Medical Center here in Mauston, and we've been learning a lot today about the skilled nursing and rehabilitation services that are offered here at Mile Bluff Medical Center. And I'm joined now by Lorraine Anderson, who is the Recreation Services Director for Fairview and Crestview. Lorraine, how are you?
Good, how are you?
Good to have you with us. So
thanks.
you're the Recreation Services Director for both the Crestview and Fairview. Can you tell me a little bit about the benefits you and your team provide for the residents of those places?
Yeah, our goal is overall wellness and to provide quality of life, and we can do that through the recreation services that we have. We like to encourage them to be more socially involved and to be physically active, to challenge themselves cognitively. We also can provide support both emotionally and spiritually. And we like to really provide joy through our services to assure that the residents aren't feeling bored, that there's things for them to do that they enjoy personally, and really for them to establish relationships with their peers and with the staff there. It's very comforting to them, and they find that important. And we really find that our services can kind of help make them feel as home-like as possible while they're staying at our facility.
And you mentioned a three-letter word in there, joy, and I really, that's such a powerful emotion, and I think it's something that everybody needs to experience on a regular basis. So that's great. That's awesome.
Yep.
So there seems to be a misconception that all residents do is sit around and watch TV and play bingo. So how do you respond to that?
Well, that's definitely not the case, unless that is that person's preference, then that would be. But otherwise, we do provide quite a variety because everybody does have different interests and different preferences. So if somebody is more social, we have a lot of group activities that we provide, such as the games, but we also have church, live entertainment, we have different holiday parties, we do gardening, baking, men's group, things like that. We also do outings, so the residents have enjoyed going out to the park, going fishing, shopping, going out to eat, and they really enjoy those kind of things. We also have a beautician that comes into the facility and does hair appointments for anyone that's interested. We have a small library, we have a little gift shop that the residents can go to. And of course, if someone's preference is to stay more in their room, there's plenty of options for them there too. So they can watch TV or listen to music, read books, or do puzzles. Some residents really enjoy doing crafts or needlework. And then we have those that actually we've seen a lot more residents bring in their own laptops and their own tablets. And so they might read the news or go on Facebook, Skype, things like that. A lot of residents receive visitors too, from family, from friends, clergy, volunteers, even their own pets from home come in, and so that's really nice to see too. And if someone comes in with a brand new preference that we've never provided an activity like that, we do what we can to provide it. Right now we're even looking at having a paint night come into our facilities.
Oh, that'd be very cool.
Yeah, yeah.
Awesome.
So can you tell the viewers how you go about choosing what opportunity for recreation for the residents?
Yeah, sure. So my degree is in recreation therapy because we have found that it is more than just providing a game and just watching TV. So when a resident comes in, I visit with them, and I'm really trying to get their recreation history and their social history. So I'll ask them where they're from, what they did for a living, maybe their church and community involvement, their family interests that they've had in the past, and then what they've been more interested in the more recent years. I like to know their settings that they prefer, so if they do like the groups or if they've always kind of stuck to themselves and done their own things, I want to know their goals while they're staying with us, any strengths they have with recreation, and then any adaptations they might need so we can help make their stay as successful as possible. I basically want to get to know the individual as a whole, and then from that we can provide leisure opportunities that really fit that person individually.
Because it's not a one-size-fits-all solution.
No, definitely not.
Yeah.
Definitely not.
Can you tell us about the different options for people if they don't want to go to the main activity that's going on, or if there are people that need assistance, what's available to them?
Yeah, definitely. Like you said, it is tailor-made, and so if from my assessment, if I found that a person was not usually involved in many social things and they really didn't engage in much outside of their immediate family and friends, we're really not going to force anything outside of that. We're going to encourage them to continue their preference.
Right.
And so we will encourage the group programming because
Right.
we have found so many benefits. But if somebody comes in and we have found that they really have always been interested in being socially involved, but they haven't been doing that at the nursing home, we'll look at what barriers there might be and try to eliminate those barriers for a more successful stay. So
yeah, opening up opportunities for face-to-face contact, I think, is really important for folks who are in those types of places. So I think that's great. So Lorraine Anderson, thank you so much for the info today. Don't go away. There's still more Wisconsin doctors here at Mile Bluff Medical Center coming up right after this. Stick around. And welcome back to Wisconsin Doctors, and we've been on location at Mile Bluff Medical Center here in Boston, and we've been talking about skilled nursing and rehabilitation today on the show, and those types of services that are offered here at Mile Bluff Medical Center. And next I'll be joined by Mary Brown, who is the rehab coordinator and physical therapy assistant for both Crestview and Fairview. Welcome, Mary.
Welcome, thank you.
Yeah, thank you for being here. Thanks for having us. So talk to us a little bit about the role that rehabilitation plays in a skilled nursing setting.
In the rehab, we provide therapy at Crestview and Fairview to individuals that have had surgery or illness or an accident.
Sure.
So what happens, they come in and we'll do an evaluation and with the physical therapist and we'll treat according to what is needed. Our rehab team consists of licensed therapists, and the licensed therapists are from physical therapist to physical therapist assistant to occupational therapy, occupational therapist, certified occupational therapist assistant, and speech therapist. We're all licensed through the state of Wisconsin. The team members, we all work with a larger team at Crestview and Fairview, which consists of social workers, nursing, doctors, dietitians.
Big team. There's a team approach to it for sure.
Yeah,
Lots of different folks who are involved in the
Yep.
rehabilitation.
So we all work together as a team to get these individuals back home. The length of stay varies can be 1 week to several weeks. It just depends on the individual.
Sure. So this isn't just like this is not a destination necessarily. This is just sort of like a side trip, so to speak. People the goal is to get people back home.
Right. Sometimes it takes some just a little bit longer.
Sure.
And so they need that extra stay.
Yeah.
And rehab.
And that's
what we provide,
Excellent.
at both facilities. Yeah.
Excellent.
Mary, can you talk a little bit about the rehabilitation process at both facilities?
Okay. When a resident is admitted, the patient's admitted, we do an evaluation from the doctor's order if it's a physical therapist, occupational therapist, or a speech therapist. They develop a plan of care, which is individualized to that patient. They work together with the patient on what goals they want to achieve so they can return home. During their stay there, we can provide our treatments according to their plan of care, which could be teaching them how to walk again, teaching them how to stand up, teach them safety awareness, fall prevention, strengthening exercises, balance. And we work together with OT, PT, and speech and nursing all to make those goals.
working and try to bring them back to a level of independence where they can go home.
Right,
again.
yep, we want to get them back to their highest level of independence.
Yep, yep.
That they can get to, and so the family can also assist them if needed.
Right.
Too,
Yeah,
so.
absolutely.
We also have restorative care,
Mm-hmm.
which is specialized training with our CNA certified nursing staff that we educate them on certain exercises and walking and stuff. So our residents, when they're not in the physical therapy room or the rehab room, they're also being, walked by the restorative staff, so they're getting walked, so they're getting some other exercise, or so it's not just what all happens in rehab too. We
Right.
also have staff trained to.
So that it's
outside of the
spread
rehab
out throughout
department.
the day
Yep.
versus just all concentrated
Exactly,
into one.
exactly.
That's
Yep.
good. That's great.
Yep.
Can you talk a little bit about the rehab gyms and what different type of equipment you guys use every day?
Okay, we have weights and bikes and mat tables. We do a lot of one-on-one. We work with balance, walkers, canes, a lot of adaptive equipment that an individual might need to help get their shoes on, or a reacher to pick up something off the floor. Also, Bluff Medical Center Foundation recently, within the last couple of years, they have purchased equipment for us. Parallel bars, which has been nice because they lift up automatic and up and out, so we can get the wheelchair in, so it can provide more safety. They've purchased New Step, which is a bike for arms and legs for strengthening and cardiovascular. They've purchased a light gate system, which helps the safety, to keep the patient's safety standing, and then my hands are free to work on gate mechanics and stuff. So they've been real helpful in providing us equipment.
Excellent. And then again, the goal is to get the patients to eventually be able to get their highest level of independence so that they can return home.
Yeah.
So that's
Yeah.
excellent. Mary, we're out of time.
Oh, we are.
We are. So
Okay.
thank you so much for the information.
Okay.
Mary Brown is the physical therapy assistant for both Crestview and Fairview here at Bluff Medical Center, and that's all the time we have for Wisconsin Doctors. We invite you from CW57 to live longer and live better. We'll see you next time.